Arety mandoza coronavirus. Tsy koragna tsao fa tena misy. Elankelagna tokony atao 1 metatra. Aza mifampitosina koa mifampipetaka. Arao mifepetra fa zatao mampimalo. Fa aloha atsika hiara andresy ny fahavalo. Tsy aza atao aloha mifandray tanana. Fa zegny tsy ataotsika androboka ny fihavanana. Ke volagna tsika jiaby ry fokon'olo. Na mivily anao io namba ny volo. Satria fa io na raiky fa tsy folo. Coronavirus abako tena mamono. Anao koa semotro mikoaka ndraiky mafanafana. Mandiana l'hôpital malaky fa aza miagnahagna. Izy koa fa misy raha ilentena. Mba olo raiky an-tragno fo mizaha izy amin'ny tsena.
Tsika toromaty napetraka ny fanjakana 910-913 mety ka izy koa mila fagnampagazavagna.
Zegny izy avako mba ho lavitry ny coronavirus. Ialatsika mandrôra ndraiky magnaka amin'ny tany. Mba ho lavitry corona, corona, sasa amin'ny savogno ny tagnana, beka atsika ho salama.
Aruvany vatanganao, aruvany havanao, paretigny ty ratsy. Ito ino coronavirus, paretigny mahafaty.
Welcome everyone, and thank you for joining Blue Ventures Tocotelo series, How Can Experiences from COVID-19 Help Networks and Organisations Support Fishing Communities? There'll be two parts of this event. First, presentations followed by questions and answers session, with the opportunity for you, the audience, to submit questions, followed by the second part, which will be a breakout room discussion. Those who've registered for the second part of this event will have received a separate Zoom link for this. This first part of the event is also being live streamed and recorded. The panel discussion will draw out some of the factors that make communities more vulnerable or more resilient to shocks, and examine how community-based organisations and networks can support communities to build resilience. To ask questions, please use the YouTube comments box. If you're watching in the Tocotelo site, the box is on the right-hand side of the video. If you're watching on YouTube, the comments box is under the video. In order to make the comment, you will need to be logged into your YouTube account. Please note that all comments made are public and will be attributed to you. Please can we ask that your questions to the panel are concise and relevant to the theme of today's event. In the breakout rooms in the second section, you'll be able to unmute your camera buttons and the chat box, and we want to create a place where everyone has the opportunity to voice their opinions and ideas, so please do contribute and allow others to do the same. This panel will be recorded and live streamed, but not the breakout room discussions. For any technical problems, please send an email to digital@blueventures.org. At the end of this session and event, there will be a short feedback questionnaire, which we'd really appreciate you taking a moment to fill in. It would also be great to hear where you're joining us from today, so please type your country into the comments box. So without further ado, I'd like to introduce the chair for today's event, Dr. Vic Mohan, Director of Community Health at Blue Ventures. Vic.
Thank you, Naya, and the whole Blue Ventures team for creating this event. And on behalf of Blue Ventures, welcome everybody to this conversation. This is an opportunity for us to reflect upon and share our experiences of COVID-19 and to try and answer this important question. How can experiences from COVID-19 help networks and organizations support fishing communities? I'd like to start by reminding us all that this global health crisis is part of a wider environmental crisis, which we need to address in a holistic way. The pandemic has highlighted weaknesses in our global public health systems. The impact the pandemic has had on us, our work, and the communities with whom we partner remind us about the interaction between human and environmental health. I believe that any attempts to rebuild our societies and to support the resilience of coastal communities must acknowledge this, and we must work to strengthen health systems as well as the systems for safeguarding livelihoods and the marine environment. And this is a belief increasingly held and shared by those in both the health and environment sectors. So as you listen to and reflect upon what's being shared, we'd like you to think about what contributes to community resilience or vulnerability and what strategies we can use to address this, as we'll be discussing this in our breakout groups later for those who are joining. During the talks, please submit your questions as they arise by typing them into the chat function on YouTube, as Naya has said, and we'll put a selection of these to our panel of speakers once they've all given their presentations. And now I'm delighted to introduce you to our panel. Yvonne Muya and Jane Muteti join us from Kenya and are representing their organisation, the Coastal and Marine Resource Development, or COMRED. Yvonne will be speaking and Jane will be answering questions afterwards. Terry Tuckson joins us all the way from Fiji and is the Assistant Coordinator for the Locally Managed Marine Areas Network. Prissa Ratsimbazafi joins us from Madagascar and is representing Mahari, a network that supports Madagascar's locally managed marine areas. Welcome all, and I'm delighted to have you all at today's Tocotelo event. So without any further ado, I'd like to introduce our first speaker. So Yvonne from COMRED, the stage is yours. Please come and speak to us.
Thank you, Vic. I will be making a presentation. Our case study area is the Shimoni-Vanga Seascape. Yes, our case study area is the Shimoni-Vanga Seascape. The Shimoni-Vanga Seascape lies in the southern coast of Kenya, Kwale County to be precise. It borders Tanzania as well. The seascape covers an area of about 860 kilometers squares. Yes, you can see from the map there. The shaded area in pink, that is the whole seascape, the Shimoni-Vanga seascape. And within the seascape, we have 7 BMUs, each with an individual CMA, a co-management area that is managed by the BMU. The BMU is a beach management unit. As you can see on the map, the whole shaded area, there is seven BMUs, Jimbo BMU, Vanga CMA, Majoreni, Kibuyuni, Wasini, Mkwiro, and Shimoni. Some of the resources found within the Shimoni-Vanga seascape include corals, we have seagrass, mangroves, fisheries, and marine mammals. The population is approximately 18,000 people. This is from the recent census. Yes, sources of livelihood for the people living within the Shimoni-Vanga seascape include fishing, which is a majority. A majority of the community members practice fishing. There's fish trading, fish farming, small-scale farming, livestock production, and tourism. Women from this area are mostly involved in small-scale fish processing and selling. Now, come to what makes these communities vulnerable, especially during this time, COVID-19 time, right? The communities here practice traditional fishing methods, which leads to high occupational risk. And then there's the unpredictability of the seasons. You know, at one point, the tides are high, the next day, the tides are low. And as you can see in this picture, this month, this is a dugout canoe. And when the tides are high, let's say the seasons change and the tides get high, it's not really going to be easy for him to fish. Then there's overexploitation of resources, which leads to reduced catches, low income, and increase in poverty. Over-reliance on a single livelihood source, socioeconomic disparities, low capital amongst fishers, small-scale traders and processors. Then there's dominance of capitalized middlemen and poor linkages to markets. Community coping mechanisms during the COVID-19. So these are some of the things that the community members from the Shimoni-Vanga seascape have been doing during this pandemic in order to cope, because times were really hard for everyone. They've been trading goods for services and vice versa. Like if I have fish and maybe you have flour and I do not have flour, we could change. They just went back to barter trade, which made it easier because, you know, currency has not been available that much. Then there's small-scale farming and fishing, mangrove nursery establishment, and a bit of livestock production. How do we improve the resilience of these communities? One of the things we felt could be done is training, provision of alternative livelihood options, because you saw from my previous slide, they depend on a single source of livelihood. If we give them an alternative, it would be easier for them to become resilient, right? Then enhancing existing livelihood strategies, capacity building of technical skills. Most of the community members are not really, their technical abilities, let's say computer literacy is not that much, but it's really a good skill to have. Then involving stakeholders in developing resilience plans for the community-based organizations, integration of a seascape strategy into county development plans and making a budget for that as well, improving access to capital, and then improving access to markets. By improving access to markets, we'll have done away with the middleman, which is a really big crisis in the south coast of Kenya. More on building the resilience. Well, resource mobilization and networking for community conservation projects. You see, most of the communities here, they have conservation projects going, right? But due to funding or low funding, it's a bit hard for them to implement what they have, the plans, the conservation projects they have planned. Then building social cohesion of the communities, facilitating establishment of saving schemes, then adaptive management practices. That's it for now. If you have any questions, just type in on the YouTube chat, please, and we could answer your questions. I hope you enjoyed the presentation.
Wow, thank you very much, Yvonne. That was an incredibly concise summary of the the vulnerabilities and resilience of those communities. Thank you very much, and thank you for keeping to time. So next we're going to we'll have questions for Jane once we've heard the other panelists speak. So next I'd like to invite Terry from the LMMA network in Fiji. Welcome, Terry.
Thank you. Good evening, everyone. My name is Terry Tuckson. I am from Suva in the Fiji Islands, and I work with the locally managed marine area network. The LMMA network supports and promotes community empowerment and resilience at international and regional scale. In April this year, funded by the Pacific European Union Marine Partnership Program, we started coordinating surveys to investigate the impacts the coronavirus pandemic may have had on coastal and island communities in the South Pacific. Next slide, please. The survey was adapted by the LMMA network and partners from one originally developed by the World Fish Center in the Solomon Islands. The survey, or a version of it, was carried out in 7 countries across the Pacific region. The number of surveys are indicated next to the country name, and the bottom of the slide lists all the organizations that conducted the surveys in their respective countries. In PNG, surveys were conducted in Central and New Island provinces. In the Federated States of Micronesia, surveys were conducted on the main islands of Pohnpei, Kozrai, and Yap. In the Solomon Islands, they were conducted in Western Province, Central Province, and Malaita. 4 outer islands in Tuvalu. In Vanuatu, 23 communities of varying remoteness, and surveys from the outer islands Vavau group in Tonga. In Fiji, 76 surveys were conducted with indigenous Itauke communities, 61 surveys with small-scale commercial fishers of Indo-Fijian descent, and 46 surveys with small-scale commercial fishers of Itauke descent. Next slide, please. The survey was conducted either over the phone or face-to-face with both adult and youth key informants. Key informants meaning they were either part of the relevant village committee or were actively involved in fishing activities. Respondents were asked about major events in the village, purposely avoiding any prompting about the COVID pandemic. We were interested to see if there was any immigration or out-migration, changes in fishing activities and catch observations, whether there were any changes in agricultural activities, status of food availability, and changes in traditional sharing practices, marine resource management efforts or the lack of, and changes in rule breaking of current management efforts. We also asked questions on whether there were any changes in the prices of staple store-bought foods like rice and tinned fish, whether they felt any stresses at this time, or if they felt like they needed government assistance. Next slide, please. So what did we find out? With the exception of Papua New Guinea and Fiji and now Solomon Islands, Pacific Island countries have been free of the coronavirus, so impacts have mainly been from government-imposed restrictions and closed international borders. In the Solomon Islands, Vanuatu, and Tuvalu, the government encouraged migration from capital cities back to home villages or to outer islands. Other government restrictions in the Pacific include ongoing nationwide curfews, disrupted inter-island shipping services, causing shortages in village canteens and reduced fuel availability, and social gathering restrictions that affected or canceled village meetings, just to name a few. Where there has been less hardship, it seems that resilience may partly be the cause. Factors like communal living, cultural practices, steady food production systems, and governance structures all can contribute to a resilient coastal community. Pacific communities have home gardens, and many will have collective community gardens. They utilize their available marine resources, and throughout the Pacific, there is some degree of legal recognition of traditional ownership of fishing grounds or rights of access for traditional resource users to these fishing grounds. Where there is less access to land and opportunity for home gardening, amongst other things, hardship is more acute, as seen in small-scale commercial fishers of Indo-Fijian descent in Fiji. Vulnerability factors can include lack of access to information and communications, and lack of adequate medical and government services in remote communities, reliance on single-source incomes, and or too heavy a reliance on the cash economy, and thus the dependence on access to markets. Pacific communities are often under threat from natural disasters. Fiji, Tonga, Vanuatu, and Solomon Islands were all hit by Tropical Cyclone Harold in early April. Recovery from disasters such as these can take months, if not years. During the survey period, drought had affected communities in Papua New Guinea and Vanuatu, resulting in poor harvests. These regular negative occurrences were compounded by the impacts of COVID government restrictions. For example, where there was an influx of people or a delay in shipping services, extra pressure was placed on existing food resources, and it takes months for root crops to mature. Next slide, please. So what can we do? With widespread loss of employment and obligatory increases in national self-reliance for an unknown time into the future, resource management, which aims to ensure continuous and sustained supply of vital food and protein, needs to be reinforced and valued. Unlike the short-term responses to natural disasters, which include relaxing fishing regulations to temporarily relieve food shortages caused by a loss of gardens, such reductions in management do not make sense in this long-term and unpredictable crisis. In the longer term, it is important to develop ways to address vulnerability factors, such as diversifying livelihoods, relieving pressure on nearshore coastal marine resources with alternatives, and localized solutions for sustainable development are only a few examples how we can help. Next slide, please. So, while Pacific Island nations did not yet have direct health impacts from the coronavirus pandemic, the trickle-down effects from government restrictions did indeed have an impact on even the remotest of Pacific Island communities. Whilst negatively impacted, many but not all Pacific communities have emerged resilient, and it's important to understand how and where they have, so this can be used to inform relevant authorities and to assist other less resilient communities. Thank you, and Vinaka Vakalevu.
Terry, thank you. That was a fascinating presentation. Wonderful insights to come out from those surveys, which I'm sure many of us here would like to learn more about and perhaps discuss in greater detail later.
Okay, thank you.
So, thank you, Terry. And now I would like to invite our final speaker to the stage, Prisa Ratsimbazafi, who is here from Madagascar, representing the Mahari LMMA network. Welcome, Prisa. Over to you.
Thank you. Thank you. Good morning, everyone. I am from the Mihari network in Madagascar. It's a network of locally managed marine areas, along with their 25 supporting NGOs. And so today I'm going to talk about, next slide, please, a survey that Mihari has done on COVID-19. Next. So the goals of this survey were to assess first the understanding and knowledge of LMMA communities on COVID, to evaluate the impacts of COVID on these communities, and to think about how to carry the network's activities in the future, and finally to take measures to further support the communities in managing their resources. There were 4 groups of people who were surveyed, including LMMA community members from the 4 Mihari regional hubs, covering 10 coastal regions in Madagascar, representatives of NGOs, groups working in seafood collect and sale, and local authority representatives. Next slide, please. So there are 3 aspects from the results of the survey. The first was on how the LMMA communities know about COVID, given that most of them are located in remote and isolated areas. So first, most of them receive news and information from the radio, and less than half of them knew that the virus is transmitted through saliva and not respecting social or physical distanciation. Then most of them know that hand washing is the first prevention method. However, 63% of them do not even have access to easy access to clean water and soap. Next, thank you. The results also showed that communities still have hardship to get basic healthcare, such as going to hospitals or to the nearest health center, because they have to either walk or take pirogues. Next, please. The pandemic has had impacts on small-scale fisheries, of course, and since the start of the state of health emergency in the country, seafood export has slowed down significantly. Besides, there were travel bans within the country itself, and that led to seafood collectors to also halt their activities. And As a result, almost all of the surveyed people say that their daily income decreased because they were not able to go fishing as much as they used to. And the state also ordered people to stay home from noon or 1 p.m. So that limited their activities during the day. Yet their expenses increased due to the fact that they have to buy more soap and they have to buy more water and masks. Additionally, the amount of sold products and the selling prices have decreased. Other impacts were that there were increase in insecurity and migration from inland mainly. There were inflation, and since money was lacking, some people went back to bartering. Next slide, please. We then asked the communities what their fears are from this pandemic, and it seems that they are quite optimistic because almost half of them think nothing would come, but would just go back to normal life. Some of them fear for an economic hardship or that there would be a second wave of COVID. For their expectations, community members mostly are waiting for food and basic needs donations, and that the fishing activities will resume and be reinvigorated. Next slide, please. So these results of the survey were presented to the Ministry of Fisheries, and then after the meeting, it has been suggested that a joint COVID commission should be created to address these multi-sectoral issues we have seen earlier, as it includes many aspects, social aspects, economic issues, healthcare, and obviously fisheries issues. And so that's how the commission was born, and its mission is to create a national and multi-sectoral support movement to enable fishing communities to be more resilient to COVID. And the members of this commission include a variety of entities from public sectors, private sectors to NGOs and other stakeholders. Next slide, please. Thank you. And so this commission will be used first to serve as a platform for dialogue to facilitate relations between stakeholders, and to use the survey results to analyze all the challenges faced by fishers communities and to identify solutions. And lastly, to ensure that the proposed actions will be implemented and monitored all over the country and at the LMA communities at the local level. Thank you, and if you have any questions, do not hesitate to type in the comment section.
Thank you, Prisca. That was a really fascinating presentation, and if slightly disturbing to hear the impact of COVID on the fishery sector in Madagascar. Thank you for sharing. Yeah. So thank you once again to our panelists, to Prisca, to our speakers, to Prisca, to Yvonne, and to Terry. Thank you all for speaking now. So we've heard now a case study from Kenya on how COVID has impacted and how to build the resilience of those communities. We've heard the results of a survey from the LMA network in the Pacific, thanks to Terry, and we've now heard about responses of the LMA network Mihari in Madagascar, following on from a survey of the impact of COVID on fishing communities there. So some fantastic insights for us. So I'm sure you'll all have lots of questions. So please use the function on YouTube, as you're seeing at the bottom of your screen, to share questions to the panel for the panelists. I have a question for Terry. So Terry, what is an example of a traditional practice in the South Pacific that contributes towards being a more resilient community?
Thank you very much for that question, Vic. Well, here in Fiji, we have a cultural, I would say it's part of our culture, called Solosolovaki. And it's a community collective action towards the same goal in the village, to do with fishing activities, farming activities. A big part of it is sharing. So any excess food you have from the plantation or from your fish catch, you'll share, and especially with the more vulnerable in the widows are often, or the elderly are often shared with, or those less fortunate. Thank you for that question.
Thank you. So it feels to me what you're talking about is community, and
Yes.
the social capital that's built through community. That's wonderful, and I think that's really a universal contributor to resilience, I would imagine. Thank you, Terry. I have a question now for Prissa from Madagascar. Prissa, how long will the Joint Commission continue for, and what are the priority actions that they will take?
Yeah, thank you for the question. So how long will the commission continue to work for? Actually, it's supposed to be a commission that will not only work during this COVID period, but will also evolve into a commission that will help communities be resilient to, for example, natural disasters and other hardships that they could encounter. And so there is no fixed period of time. We hope it will last as long as the communities will need them. And their priorities, actions. So first, we are in the middle of elaborating all the action plan. We have a draft. It has not been validated yet, but since there are many actors involved in it, we had to find time just to gather everyone. We've had a couple of meetings to draft the terms of references of this commission, and the action plan will cover a lot of aspects, including communication, health, trade, sustainable development, and the private and public sectors. And so we are in the middle of elaborating and finalizing the action plan right now.
Thank you, Prissa. And it's lovely to hear how the Mihari is using this as an opportunity to strengthen resilience more broadly, and the lessons learned from this can hopefully serve to strengthen community resilience to whatever shock they may face in the future. That's really, really great to hear. I have a question now for Jane from Comrade. So Jane, what alternative livelihoods would work in your area?
Thank you so much for the question, Vic. From our slides, we've seen that communities are involved in other activities such as livestock production. We also have seaweed farming in some of the communities and ecotourism. So as we suggested, one of the ways of improving the resilience of these communities is supporting these existing alternative livelihoods. And to answer your question, we cannot predict or rather suggest what alternative livelihoods can work, but rather we need to conduct a survey because these communities know what can work for them. So we cannot actually guess, we need to and then understand and see how we can support them. Yeah. Thank you.
Okay, so it really comes down to what's appropriate for that community, I guess is what you're saying there, Jane. Thank you. I have a question now for the entire panel. In the UK, you may or may not know that we have different restrictions at different regional levels, which is often confusing and leads to a lack of adherence to those restrictions. What role do you think networks play in disseminating good information? Any or all of you? Prissa, please.
Yeah.
Okay. So first off,
it's Terry. Go ahead. Then we'll come to Prissa. Please go ahead, Terry. Terry, can you hear us? Please go ahead. Unfortunately, Terry's having some problems with their internet.
Here in the Pacific, first of all, the information that, or the data, yeah.
Yeah, please go ahead, Terry. Seems like we have a delay, but Terry, please go ahead. I hope you can still hear us.
Okay, here in the Pacific, the results that we gathered from the survey, first and foremost, go back to the communities through the organizations that conducted the surveys. And then after that, we make sure to share it with local level government and subnational government as much as we can. That's it from now, and thank you.
Thank you, Terry. Glad we managed to catch your response there. Prista, we'd love to hear from you on that response, on that question.
Yes, so for here in Madagascar, we are trying to work with all the networks partners to gather all the information they have, and for example, if they have flyers for communities, we try to gather all of them and share them to at the local level. If the government, the ministries of fisheries or the ministry of the environment have their own information, we try to get all of those good sources of information and share them to LMMA communities.
Great, thank you, Prissa. Now I have a question for Terry, one that's close to my heart as the Director of Community Health. Should a health program be included in LMMA or in fisheries programming to ensure communities are more resilient? This is coming from the Madagascar PHE network. So I'll ask that question again. Should health program be included in LMMA / fisheries programming to ensure communities are more resilient? Terry.
Absolutely. Here in the Pacific and in the tropics especially, we have all kinds of tropical diseases. So already in our project activities around the place with our country networks, they do include some aspect of health, especially during this pandemic. This is unheard of for us to encounter. We've been lucky that there are no cases out in the community here in Fiji and throughout most of the Pacific. So the awareness is being raised, information is out there. But as far as being included in the local programming, it has been. Thank you.
Okay. Well, that's heartening to hear that that LMA networks are broadening their scope to think about health, particularly at this time. That's wonderful to hear, and thank you for the question, Nantinina. So we have a question for Jane. Are there any lessons coming out of this crisis and responses that could be relevant for the work of networks in the future, post-COVID? And thank you to Kitty for that question.
Thank you so much, Vic, for the good question. So yes, we do have lessons from this COVID-19 pandemic. And let's not forget that this is a crisis within a crisis. Poverty has been there. It's not the first time that we are learning about vulnerability of communities and poverty problems. So we are learning that we need to come up with ways of actually providing alternative livelihoods to these communities. And it's more of shifting our attention. If we have donors who are donating resources to implement projects in Kenya, maybe we can direct these resources to actually going on the ground and looking for ways together with the communities on how we can build resilience as well as create alternative livelihoods for them. And in addition to that, we cannot forget the importance of capacity building. Let's not forget that most of these communities are actually in rural areas and they don't have access to good education. And without education, they cannot get employed in our urban areas. So we can keep them through providing direct capacity building, for example, technical skills. If someone can know how to actually analyze data, they can get employed. And also we've learned that it's important for stakeholders to come together to join efforts into coming up with a resilience strategy. Because this COVID-19 has found us in a situation where nobody foresaw something like this happening. So if we could develop a strategy so that when pandemics come or any other hazard comes, we are able to know, okay, so we can do this and this in order to improve the livelihoods of these communities and to reduce the vulnerability. I hope that is clear.
Thank you, Jane. I mean, so much in your answer there. I loved your description of COVID being a crisis within a crisis. That's a very powerful message. And the idea of using this as an opportunity to address longer term resilience related goals and focusing on building capacity. I really like that. Thank you. Thank you, Jane. Another question for the whole panel. It's interesting to hear about immediate responses to the pandemic. For example, lifting taboo in Fiji to maintain food security. Any sense of how community responses have changed as the pandemic has continued? Anybody in the panel like to take that question? Prissa, would you like to take that?
Can start. Sure. So currently.
So, interestingly, here there are only a few cases where there's few.
Prissa, go ahead, and then we'll come back to Terry.
Oh, okay. Okay, thank you. So currently over here, the cases has gone down significantly. So people are more relaxed about it. However, we have seen that fishermen communities are trying to find alternative activities apart from fishing to generate more income. So there has been an increase in demand of asking for training or for helping them develop other income generating activities other than fishing.
Okay. Thank you, Prissa. And Terry, you had something to contribute as well. Would love to hear what you had to say.
Interestingly, in Fiji, lifting of the tambu was not just a response to food security for the issues during the pandemic. There were not really that much food security issues throughout Fiji, only in some areas that were badly hit by the cyclone Harold. So the lifting of the tambu is in response to many other things, can be, large church gatherings or the death of a chief, after the death of a chief, things like that. So only a few of the sites lifted the tambu in response to food security issues. I want to just make that clear.
Okay, thank you. Thank you, Terry. So I have a question now for the whole panel. So when promoting alternative livelihoods, were they already present at the community level, or have you been exploring new options since the pandemic hit? Any of the panelists?
I can go ahead.
Go ahead, please, Jane.
Okay, thank you, Vic. As I said that in Kenya, we've not conducted any survey, but from our conversations with some of the community members, they told us some of the alternative livelihoods they're pursuing, like chicken rearing. So like I mentioned, when we are talking about providing or supporting existing alternative livelihoods, we need to have a conversation with the communities. So for us, moving forward from this, it's looking for ways in which we can sit with these communities, provided resources are available, to see how we can now work with them towards provision of alternative livelihoods.
Okay, thank you. Thank you, Jane. We have a question now for Prissa. After the pandemic, should fisheries organisations continue to support communities to reinforce the access and health services, or do they not have to do any health support once the pandemic is over?
Thank you. I definitely agree that fisheries organization should continue to support the communities in the health aspects to provide healthcare and services to communities. And actually, there are a couple of NGO partners who already have those programs in their communities. For some, they don't. So even if the pandemic is over, having health services ready in place is always necessary for communities, because health and environment, the sustainable management, all ensure the well-being of the community, so they go hand in hand.
Thank you, Priscilla. That's, again, as a doctor, that's lovely to hear. So I have one final question before we move to the second part of this event, and that question is for Terry. Terry, how can we build capacity at scale and accelerate dimensions of knowledge across the communities, especially with low technology ICT?
Thank you for the question, Vic. The LMMA network is actually engaging in what we call the 100% solution. We're implementing this across Melanesia in 4 countries under the Pacific European Union Marine Partnership Program. And we're doing that by engaging with our local partner in the country and building scale at the provincial level with the Provincial Fisheries Office, as well as community-based fisheries management through community champions, and also through low-cost communication strategies. So we're within each Melanesian country, we're looking at what are the most cost-effective ways that we can disseminate community-based fisheries management to the last mile. And for each country will be different, so we're exploring radio, social media, and different aspects. So it's almost a 3-pronged approach, upskilling at the provincial office level, community level, as well as the information strategy.
Great, thank you, Terry. And thank you all to our audience for their questions. Some really fantastic questions that have asked just the sorts of things I would like to learn more about, and I'm sure that's true of all of you. So thank you very much, and thank you once again to our panel, to Terry, to Prissa, to Jane and Yvonne for your presentation and for answering the questions so skillfully. We are now going to move on to the second part of this event. And this is an opportunity for us to take these ideas and to discuss them in greater depth. Okay, so you'll soon be given a link. You'll soon be given a link in the comment section, which you need to copy into your browser. It will take you to the Zoom meeting, which is the second part of this event for those of you who have registered. Okay. If there are any problems with that, the link is also in the email that we sent to you today. The email is titled "Important Joining Instructions for Toku Telu Event." Okay, and that includes the Zoom passcode. Okay. When we close this current event, you will lose the link to the new meeting. So please make sure you copy the link. Okay. And for those of you who are joining and who have pre-registered for the workshop, we would now like to invite you to discuss these issues in greater depth. You'll be divided into smaller groups, giving you the opportunity to all participate more actively and share your own experiences of responding to COVID-19. Each group will have a facilitator and a note taker who will share with you 3 questions that we'd like you to respond to. You'll have about half an hour in your groups to discuss these questions, and then we'll bring you back to the main room to hear each group's responses to these questions. Unlike this session now, these sessions will not be recorded, although we will be sharing written anonymized notes from discussions. So we invite you to share ideas and experiences openly to allow everyone to benefit from the considerable experience and wisdom within this group of people. Whoever is nominated to feed back to us after the discussions, we ask you to do that at the beginning of the group discussion. And we would like you to share about a 1-minute summary of your responses to the questions. So I hope that's all clear. You should now be able to access the Zoom link in the comments. If you please copy that into your browser, that will then take you directly to the Zoom breakout room. Thank you all.